Hello everyone, and welcome. Today we're diving deep into a rare but fascinating endocrine disorder affecting the digestive system, glucagonoma. We'll explore what it is, what causes it, how it affects the body, and what can be done about it. So, let's get started on understanding glucagonoma. Glucagonoma, at its core, is almost always caused by a tumor, specifically a tumor that arises from the alpha cells of the pancreas. These alpha cells are normally responsible for producing glucagon, a hormone that raises blood sugar levels. While the exact reasons why these tumors develop are not fully understood, the vast majority are sporadic, meaning they occur randomly without a known genetic predisposition. In rare cases, glucagonomas can be associated with genetic syndromes like multiple endocrine neoplasia type 1, or MIM-1. Now let's talk about how glucagonoma affects the body. The tumor secretes excessively high levels of glucagon. This excess glucagon leads to a cascade of effects. Firstly, it significantly elevates blood sugar levels, often resulting in diabetes-like symptoms. It also stimulates the breakdown of proteins and fats, leading to weight loss and malnutrition. Perhaps the most distinctive effect of glucagonoma is its impact on the skin, causing a characteristic rash known as necrolytic migratory erythema, which we'll discuss further in the symptoms section. Glucagonoma is a relatively rare disease. It's estimated to affect around 1 in 20 million people. Because it's so uncommon, large-scale epidemiological studies are difficult to conduct. It tends to be diagnosed more frequently in middle-aged and older adults, typically between the ages of 40 and 70, but it can occur at any age. The signs and symptoms of glucagonoma can be quite varied, which can sometimes make diagnosis challenging. The most common and distinctive symptom is the aforementioned necrolytic migratory erythema, or NME. This is a painful, blistering, and crusting rash that often affects the lower abdomen, groin, and extremities. Other common symptoms include high blood sugar levels leading to diabetes, weight loss, diarrhea, anemia, and blood clots, also known as deep vein thrombosis. Depression and neuropsychiatric changes can also occur in some patients. Because many of these symptoms can be caused by other conditions, it's crucial to consider glucagonoma in the differential diagnosis when they appear together, especially in conjunction with the characteristic skin rash. Diagnosing glucagonoma involves a combination of clinical evaluation, blood tests, and imaging studies. A key diagnostic marker is a significantly elevated glucagon level in the blood, often several times higher than normal. Doctors will also order blood tests to assess blood sugar levels and rule out other conditions. Imaging studies like CT scans, MRI, or somatostatin receptor scintigraphy are used to locate the tumor within the pancreas and determine if it has spread to other organs. Glucagonomas aren't typically classified into subtypes, but they are categorized based on whether they are functional or non-functional. Functional tumors secrete glucagon, leading to the characteristic signs and symptoms. Non-functional tumors, which are rarer, don't secrete significant amounts of glucagon and may be discovered incidentally during imaging studies performed for other reasons. Treatment for glucagonoma focuses on managing the symptoms caused by excess glucagon and removing or controlling the tumor. The primary treatment goal is surgical resection, if possible. Complete surgical removal of the tumor offers the best chance of long-term survival. However, if the tumor has spread to other organs and cannot be completely removed, other treatments may be necessary. These include medications to suppress glucagon secretion, chemotherapy to shrink the tumor, targeted therapies, and treatments to manage the symptoms of diabetes and the skin rash. Octreotide, a somatostatin analog, is often used to help control glucagon secretion and alleviate symptoms. Nutritional support is also critical to address weight loss and malnutrition. The skin rash can be treated with topical corticosteroids and other medications. Unfortunately, there are no specific preventative measures for glucagonoma, as the causes are largely unknown and often sporadic. Maintaining a healthy lifestyle with a balanced diet and regular exercise is always beneficial for overall health, but it doesn't specifically prevent the development of these tumors. If you have a family history of MIM-1, genetic screening and regular check-ups may be recommended to monitor for the development of any endocrine tumors, including glucagonomas. The prognosis for glucagonoma depends on several factors, including the stage of the tumor at diagnosis, whether it has spread to other organs, and the patient's overall health. If the tumor can be completely surgically removed, the prognosis is generally good, with a high chance of long-term survival. However, if the tumor has metastasized, the prognosis is less favorable. Recent research has focused on developing more effective targeted therapies for glucagonoma and improving diagnostic techniques. These efforts aim to improve patient outcomes and quality of life. As we learn more about the molecular mechanisms driving glucagonoma development, we can hope for even more effective treatments in the future. Thanks for joining me on this overview of glucagonoma.